A medical practice that does not accept any insurance from patients. Instead, costs of services are clearly spelled out and you pay up front. A doctor in Apex is one of the first in the country to start what's called a direct pay model. WRAL examines healthcare tonight. Renee Chu looks at how this setup could be used as a model for the future.
And let it out. Good.
To stay in good health, it helps to have a good doctor. Kathy Boggs has been coming to see Dr. Brian Forrest for 8 years now.
I get excellent medical care.
She has health insurance, but at the end of this visit, Boggs will pay in cash.
We don't file or accept insurance of any type.
The reason? It saves money. Overhead costs associated with filing insurance at medical practices run an average of $250,000 a year.
If you were to go in a traditional office, you'll usually see someone who's filing the insurance, somebody who's doing the billing, somebody who's doing the coding.
Not at Access Healthcare in Apex. There's someone to answer phones and check people in, and a medical assistant who helps the two physicians and a nurse practitioner. The small staff slashes overhead costs.
We can pass those savings directly on to the patients.
Access Healthcare displays fees for all services right there in the waiting room. Physicals, $49. Cholesterol test, $30. Prostate or thyroid screening, $30.
And those prices generally are about 80 to 85% less than what they're going to be in traditional medical settings.
Forrest opened Access Healthcare in 2002 to make healthcare affordable for those without insurance. But about half his patients have insurance, pay for services, then file on their own.
There are no surprises. You know what you're getting. You know what you're spending for it.
And many times our services are priced so low that it can actually be less expensive for them to come here than to go somewhere and use their in-network coverage.
That's not to say we should do without insurance. Dr. Forrest encourages patients to at least get hospital and specialist coverage. Dr. Forrest makes the analogy that health insurance should be like car insurance. You get coverage for the catastrophic stuff, if your car breaks down, if you need surgery. But it's up to you to pay for the maintenance, and you can shop around for the best price and service. Dr. Forrest sees this as the future model for healthcare. Dr. Forrest says not dealing with insurance allows more time with patients. He schedules just one patient an hour.
Having more time improves quality.
He says the no insurance clinic does what many people want out of healthcare reform: increased access for the uninsured, decreased costs, and price transparency.
You wouldn't buy clothes and not ask how much it cost before you got to the counter or look to see. Why should medicine be different?
Why should it? A question Dr. Forrest dared to ask and answered with a viable practice. Renee Chu, WRAL News, Apex.
Within the next 18 months, Dr. Brian Forrest says he anticipates another 250 practices to open as or convert to a direct pay model. More than 10 of those will be in North Carolina.